So next, the intra-operative management of our obstetric patients that's undergoing a cesarean section. So anesthetic-wise, anaesthetist will give a regional block, either a spinal, an epidural, or a combination. So the advantage of an epidural is you can top it up, whereas a spinal is one single bolus. And this is to prevent analgesia of the womb area. At the same time, it causes a motor block, and unfortunately, therefore, you need to put an IDC in place, otherwise you won't hold your wee up. The other thing that can happen is at the end of the surgery, the anaesthetist may place a TAP block, that's the transabdominal plane block, to provide further analgesia. Also at the end, to cause contraction of the uterus, to prevent postpartum hemorrhage, oxytocin, or syntocinon it's called, or an alternative is Girotocin, and this is IV, or sometimes ergometry needs to be added as well. Maternal hypothermia prevention, so we need to use warmed IV fluids, get the OR temperature nice, 22-23 degrees. If needed, force air warming on the legs, but that's not always done. Fluid management wise, you need maintenance fluid, usually Hartmann's, and or in other hospitals Plasmolite, and a vasopressor in the background, and that's phenylephrine is the preferred choice of a vasopressor. Then there is a concern with clamping the cord, and if you wait for over a minute, this prevents neonatal anemia. Then the closing of the womb, it's the uterus that needs to be closed. The peritoneum and the muscle layer often don't need to be closed, and this may help to prevent adhesions, which are very painful. And also the skin needs to be sutured. That follows with the sign out.